We have created the In Seconds brand of training systems and to be a simple and effective way to regularly train for pediatric emergencies. A Navy SEAL said it best, under pressure, we don't rise to the occasion, we sink to the level of our training. Whether it's Peds prep in seconds, scenarios in seconds, disasters in seconds, all of the Manny kids are able to be set up. You can do this one-on-one with a student. You can set up and do an entire class. A burn patient, you can be talking about, are we going to talk about fluid calculations? Maybe have them calculate the rule of nines. I mean, there's so much you can do here. A head injury versus an evisceration. This child has burns on their face. What are we thinking about airway? So it gives you as an educator, obviously the ability to talk about lots of unique things. So if you're working on anatomy terminology, or you want them to actually be able to place and identify, use it like a quiz if you wanted to, or maybe you want them to do pulse points. And so sticky notes come off. All right, everybody, where are we gonna find the brachial artery? Where are we gonna find the femoral artery? Where are we going? And it just allows you to use these in a really easy way. You can have an entire cardiac class built around the scenarios in seconds just by pulling out the cardiac scenarios.
So you got a 3-day-old with a really funky heart defect who is profoundly purple. Not only do you have to figure out dextrose and normal saline, but more importantly, you want to watch people seriously become diaphoretic. One of the questions involves that with this funky heart kid, you have to figure out how the heck do I mix? And even worse, how the heck do I give a prostaglandin drip to a 3-day-old before the team can happily take the baby away?
However, if you don't want to do it that way, and you don't have any of the fancy mannequins, but you want to do a very simple tactile skill for your students, for example, let's talk about an umbilical line. And so we do something where you can see that Pedi-Ed-Trics has his umbilical cord clamped. Well, there are lots of different kinds of trainers out there for umbilical lines. You've seen us do the great big MCIs where we take over a ballroom and we have everything set up and we've got special effects and the whole thing. Well, maybe you don't want to do that. One day you just want to work with, a few students and talk about triage and just do that repetition thing. So that way they're thinking about it, and then when you do set up your big disaster, they're even more prepared, because we know repetition is the mother of skill, so this just gives them another chance to do that. So if you take from any of the 12 disasters, you take the cards out, and it gives them a chance to actually look at and try to triage them. So you could sit with the students, or they could be working together in a group. Okay, I would choose it. Okay, this one's gonna be yellow. This one's gonna be green. Oh, this one is really severe. This is red. And you let them go through and actually triage all of the patients. Well, you can also give them the educator master key, because inside it tells you whether they got the answers right or not, because all of these kids should be in the green pile, and all of these people should be in the yellow pile, and so it makes it really easy to do a very quick tabletop model. And you've got 12 of them in here. So if you want to group your students, maybe 4 at a time, and let them do it, you can hand these out all around your classroom and let them physically practice triage. And then as a bonus, if you want to really trip them up just a little, on the back, there are 2 additional pediatric questions. It might be something as simple as, what are normal vital signs for a 2-year-old? All the way up to how much ketamine do we want to administer? This is, again, there's lots of different questions on the back. They're all different. And the answers, of course, are in the educator answer key for you. So if you want them to do that, they can do that as well. It gives them some extra pediatric practice. But if nothing else, you're just helping them understand basic triaging concepts, and you can set this up. This takes no time at all. So this is just a really quick idea to utilize disasters in seconds in a little bit different way.
Disasters in seconds was absolutely fantastic. Hands down, it was the best triage training that I have done.
I thought it was awesome, and the reason why I thought it was awesome is disaster training is very, very hard to do. That kind of thing is training that doesn't really come very often for us. So this was a great experience.
I think this was really good. It was a great experience doing quick triage, and using this system I think really is beneficial for something that we don't do that often.
Well, the scenario in seconds is awesome. It was the first time that I experienced it I was blown away, just absolutely blown away by not only the simplicity of it, but how easy it was to learn from it.
The Scenarios in Seconds is a very quick way that you can get regular contact with pediatric material that you know is medically sound, that you have some visual cues for, and that can give you virtual instant feedback in your performance in taking care of the kids in these scenarios. It's quick, you can do it on a regular basis, it's fun, it costs just about nothing if you do it a lot of times, and it's just going to help you in your ability to be comfortable and confident in taking care of the kids.
Having Scenarios in Seconds to go to grab that very quick, real-time education piece that is something so easy for the associates to work through themselves, and they get real-time feedback.